Hey guys, welcome back to my YouTube channel. Dr. El Ghazaoui here, sports medicine surgeon. Today I'm going to be talking to you a little bit about 5 most common tennis injuries that I see during tennis season. First one, which I'm sure is the most common and you're all familiar with it, is tennis elbow. So technical term that we use is lateral epicondylitis. Basically, it's all the tendons that attach on the outside of your elbow. What they do is they kind of move your wrist backwards. They're responsible for your fingers extending. The biggest player in this is what's called the extensor carpi radialis brevis. It's just one of those tendons that help move your wrist in extension. What happens is that it's an overuse injury. So, you're playing more, you're maybe ramping up your activity a little bit too quickly, and those tendons are trying to keep your wrist from moving and your grip strong. So they see a lot of force, and then you kind of start to develop this inflammatory situation and process that's happening at the outside of your elbow, and then you start to have pain with grip. It hurts to open cans, turn doorknobs, all those things. People come in complaining, and a lot of times you don't make the connection that they may have done too much or ramped up too quickly with their tennis. What are some things that you can do that can limit this or prevent this? Obviously, first thing, it's an overuse injury, so just going slow. You don't have to sign up for every tournament that your club might have right away. Gradual increase in activity is the easiest way to limit this tendonitis picture from happening. Some other things that can maybe decrease that rate of inflammation and pain at the lateral epicondyle is different grips. So making sure that you have proper grip on your tennis racket itself, that maybe you switch from a single hand backhand to a double hand backhand. I mean, unless of course if you're Federer and you're crushing it. It can put less risk for this inflammatory process on that outside of your elbow. Some other things that people don't really think about sometimes that can also contribute to increased force through those tendons is having your racket properly strung. So having a racket that's too tight or too loose, depending on the way that you're playing, can absolutely increase the force and going through your wrist, and then subsequently increase that inflammation because your tendons are working overtime. Another injury that I see a lot is shoulder inflammation or rotator cuff tendonitis. Your rotator cuff are a series of 4 tendons that attach around your shoulder and kind of move your shoulder in all directions. When you're serving, that overhead motion kind of has a rubbing characteristic on those tendons on the bone that is sitting right there, which is called your acromion bone. So you have the combination of doing too much with repetitive motion with the tendons that are working to move your shoulder. And that can be kind of the scenario where you develop an inflammatory process around your rotator cuff tendons too. There's going to be a common theme to all these, and that's a gradual increase in your activity, strengthening programs to make sure you're not doing too much too quick, because you get a lot of inflammation and pain that tends to shut you down for longer periods of time as opposed to slowly ramping up, which, yeah, it's annoying, and you want to jump out there and crush these serves and especially with the nice weather, play as much as you can. But the happiest patients I have are the ones that really take their time and get back into the season when the season is upon us. Some other things that you can do for treatment once you start to develop this shoulder pain, which, like I said, a lot of times is a rotator cuff tendonitis or a bursitis, is start anti-inflammatories, obviously rest from the activity, and then getting into a good physical therapy program can really get this to get better faster. The next thing we see sometimes are stress fractures. Like I said before, those are usually related to overuse and not letting your body acclimate, so doing too much too quickly. You can develop stress fractures really anywhere, but most commonly they're in the feet or the lower extremities like your shin bone. You absolutely need to take a break, and if you're having this pain that's not getting better with the easy stuff like rice treatment, you should definitely see an orthopedist that might be able to get some x-rays or even an MRI, because those injuries we don't want to turn into bigger injuries that can cause longer periods of immobilization and casting and a lot of stuff that goes along with broken bones, which is what a stress fracture really is. The next thing that I see is patellar tendonitis. So your patella is the tendon that attaches from your kneecap down to your shin bone. A lot of people call it jumper's knee too, because we see it in jumpers, in track and field. Same common theme, where we're seeing people that do too much. They're kind of lunging for balls. They're going as fast as they can, as hard as they can, and they might just be doing too much too quickly. I'm just repeating myself, but rest, gradual increase in activity, anti-inflammatories, Sometimes when these things linger, the patellar tendonitis lingers, you can get a chronic situation. We have done some stuff with injections of PRP around chronic tendonitis pictures that do respond to that, but that's something that you should discuss with your orthopedist and see if there's anything else that you can do besides the easy stuff, like I said, or a good physical therapy regimen. Ankle sprains are probably the other thing that I see that it's hard to prevent. One of the big prevention methods that I tell my patients to really work on prior to the season is a good ankle stability and balance exercises. When you're running across the court and going fast, stopping, pivoting, those ankle ligaments and tendons are really seeing a lot of force, and that's when you can kind of roll your ankle. And it can be dependent on the court that you go to also. Getting familiar with the court itself can limit those ankle sprains. If you do sustain an ankle sprain, we want to rule out the bad stuff, so we want to make sure you didn't break anything around your ankle, so getting in sooner rather than later to your orthopedic doctor. They can take x-rays. A lot of times we're putting people in a boot just to give those ligaments a little bit of rest and start the healing process. But then it's really getting you into a physical therapy regimen that is focused on that strengthening and that balance to get you back to all sports. Those are some of the most common injuries I see. I also have a lot of kind of crazy injuries, the chance occurrences, whether it's shoulder dislocations or kneecap dislocations or things like that, but definitely not as common as some of the other ones that we've talked about. So, thanks for tuning in to my YouTube channel. If there's anything that you want to hear about or learn more about, feel free to leave it in the comments, and good luck on the tennis season.